sort of magic. Brilliant. Hello, everyone. I'm Vishaka Bansi. I know some of you around the panel. Welcome to today's webinar from the class BMC 92 batch. We're talking today about mental health. So slight departure from our usual topics that cover physical health, but nonetheless very, very important and very, very useful for all of us. I will introduce the panelists that we have today. So I'm very, very happy to welcome Dr. Geeta Desai, who is a professor of psychiatry at NIMHANS. Her main areas of focus are in perinatal psychology and maternal mental health. She's authored a number of publications in this area. She also works in the field of managing chronic pain and somatization disorders. So, and of course, has had numerous a great depth of experience in this pandemic time with the various aspects, and as we mentioned in the webinar title, with the dimensions that COVID pandemic has affected, both in terms of the illnesses itself and the aftermath of the pandemic itself. So we'll look forward to hearing from her about these various issues. We also have with us Miki Bhatia. Miki Bhatia is she is a training analyst, a psychoanalyst, and she is based at a Mumbai-based NGO. This is affiliated to the Psychoanalytic Therapy and Research Center, which in itself is associated to the Indian Psychoanalytical Society and the International Psychoanalytical Society. She also works in the field of human rights and mental health and has done so for 3.5 decades now. So that's a wealth of experience that she brings from this field. She also has moved on to being a supervisor and a teacher herself and a training analyst for the future generation in this area. She gives talks on this topic. She sits on forums to share this knowledge, and I'm very glad she's been able to make it to this forum today. Welcome, Miki. Also with us is Manju Mukhi, who also works with the same organization that Miki does. She has been in this field for 15-20 years herself and is a child psychotherapist. She works with school settings, sets up counseling units, and works alongside parents and children together and individually. She's also a member of the same Psychoanalytical and Therapy and Research Center that is based in Mumbai, which is affiliated to the Indian Psychoanalytical Society. Thank you for joining us, Manju, and welcome to the panel. So the way we will organize this today is we will ask our speakers to give us a little bit of background of what they wish us to, what they wish to share with us in the first instance, and they will talk to us on subjects they feel are would be of interest to us. We have sent them a few sort of questions and that we had in mind as well. I will then keep an eye on the chat. Please put your questions to the chat. And once we have asked all three speakers to express their thoughts briefly at the beginning, we can then open up to the Q&A so that we can address the needs of the audience. So Geeta, if you would like to kick off, that'd be very helpful. I believe you have a presentation, so you can start sharing screen.
Thank you, Vishaka. I think that share screen option is not on.
It's on, Dr. Geeta.
Yeah,
you have shared it already, right?
Yeah, but now I think it's not working. Okay, let me try. No. I'm not able to share it now.
1 second, I'll.
Okay, I think I'll just make head start.
No, you stop sharing and.
No, I have not started sharing at all because that option is not there.
Okay, I'll make you host and then maybe you can do that.
Yeah. Okay, so while we sort out these issues, I would want to introduce myself. I'm Dr. Geeta, working at NIMHANS Bangalore. I see that at least I could see psychiatry colleagues who have joined in, Dr. Bandari and Dr. Satish Chandra who have joined in. So what I am going to do is I'm just going to discuss some of the mental health issues and problems that we have seen during both the phases of COVID-1 and, first phase and the second phase. But when I was writing the title for this slide, I was kind of wondering, it's 2021 and then still writing COVID-19 pandemic, and we've just still not seeing the end anywhere. And that's the question that keeps everybody, on this one. So, okay, I think I'm the host, right? Yes, I think now I can, yeah. So, what is it that is different during this pandemic? I think a lot of, there's literature on mental health issues during earlier pandemics or any other disaster. So there's a lot of discussion about it. So how is it that COVID has brought in this change? One, I think, let me just take you through the pathways, how it can have an impact on mental health. One is the direct infection. As we know that COVID can affect various organs of the body, and I think brain is also affected. So in that sense, many of the mental health symptoms and disorders can be explained because it directly affects the central nervous system. The second thing that I just want to take you through the whole course, the treatment-related adverse effects. Steroids are commonly being used, and mental health symptoms could be due to that. Or pre-exist people who have had mental illness in the past can have a worsening of their mental state or onset of new symptoms. So that is one area. Psychosocial stresses. Now, I have kind of put it as an umbrella term. If I probably start counting the number of stresses, I think the list is endless. So I just put it as a stress, which is an important factor for mental health. And the other, measures to contain the pandemic. I've just written measures to contain, like we all know, lockdowns and travel restrictions. So each one of these have a role in, causing mental health problems and disorders. So I'm not just looking at diagnosable conditions, because I think that's only some part of it, because a lot of them have subsyndromal symptoms, as well as probably even minor conditions, which can potentially have an impact on their health. I was just trying to understand, because I think there's so much discussion about anxiety and depression. It is common across many conditions. Like, for example, if you have diabetes, cancer, there's a lot of literature to say that, they experience more anxiety and depression. So what is it that is in COVID that's mental health? Is it any different? So I thought this time probably we have more understanding about how mental health has been affected. I'm going to kind of discuss in terms of people who, before they get COVID, what are the mental health issues, during COVID infection, and post-COVID. So that, because the challenges are different, and as physicians or health professionals, all of us have to deal with these consequences at different points of time. I think this is another pre-COVID. When I say pre-COVID, fear of contracting infection, fear of death, fear of isolation, fear of quarantine. I'm sure all of us will be reading reports of people taking extremes of steps to handle this fear. To very unfortunate outcome could include something like suicide, which is very, very unfortunate, due to fear of contracting infection or fear of having COVID. Some of this issue actually in the first wave, I think stigma was quite significant, and a lot of people were embarrassed about having this condition. Then there is a lot of psychological distress related to uncertainty. as well as the pandemic news related uncertainty and distress. You get to see so many difficult situations. You keep reading about death. You keep reading about difficulties patients face. I think that itself could lead to a lot of psychological distress, even though you don't have COVID yet. But the fact that you are likely to be one of them in future can lead to a lot of psychological distress. Frustration, which can actually manifest as various ways. Frustration in terms of people writing a lot of anger uh, toned messages, or being argumentative, or picking up a lot of difficult health professionals, picking up fights with health professionals. Anger, which again, I'm not saying which is right or wrong, but these are the spectrum of emotions a person can experience. Depression related to not having a social contact, or feeling isolated, sometimes just losing job, something like that, or losing family members. Then substance related problems, because I think the first lockdown, when alcohol was not available, many patients had withdrawal conditions, and they were desperate, and the withdrawal can be very severe. Sometimes people went into delirium, and if they're not treated early, they can develop complications. The other thing that we also noted was, because of lockdown and families spending more time together, escalation of interpersonal problems. This is one negative aspect, but there are also positive aspects. Is some of them could sort out IPR issues. Domestic violence, I think these are some of the things. Like, for example, domestic violence continues to be a problem, but some of these issues have now sort of settling down with more awareness and vaccination and other pressures. This is about pre-COVID. Now, what happens when somebody develops COVID? So the concerns could be, especially people can have a lot of anxiety about the course of illness, because they read that suddenly somebody died during, they were very well and then they suddenly died. So there's a lot of anxiety about how whether what is going to be their course, whether will they get the treatment on time or not. So this can lead to a lot of anxiety, and when they are anxious, that can lead to physiological arousal and hyperventilation. So both can it can kind of present as not having enough oxygenation, or probably it can have an impact on saturation. And then palpitations. So many of these things can actually make them feel that they are far worse than what their COVID symptoms are. Like I mentioned, mental health effects of treatment, steroids, and fear of death. I think thanatophobia, that's what we call it. So that's another thing, because then they see people in and around. I mean, like, we know that COVID wards, when especially in the first phase, many were admitted in a sort of a wards, and where they suddenly saw that somebody died, and as a reaction to that, they developed anxiety related to their own death. The other common symptom that has been reported is sleep disturbance. Most common is insomnia, and now insomnia can be there just not just during the infection. Now it's kind of presenting as a long COVID complications. Post-COVID, many of them are reporting insomnia. Then there's isolation-related distress. This distress, one of the things that somebody mentioned is, a very nice report of how a patient felt when the person was admitted in an ICU. Said that I was not familiar with the place, and the people who came, I couldn't see their face. So sometimes we take these things for granted, the eye to eye contact and the facial expression. So all this was missing, and that actually increased their distress. I've also written about acute stress reactions. Delirium is also sometimes being missed, and that could lead to potential problems. Stigma. I think we can take it up during the discussion, because that's something which is both faced by patients as well as healthcare professionals. Okay, that's about COVID. Then what happens? I haven't touched upon loss and grief and how it can in the acute phase. I think fatigue is something that is constantly being reported post COVID. Many of them are struggling with fatigue. And unfortunately, this fatigue can be a symptom of depression as well as a post-COVID symptom. So often it can be very confusing for the person, also for the treating doctor also, which is the part of depression and which is the part which is actually related to post-COVID complications. A lot of sensory symptoms can be there. And I think there were two studies, very interesting studies, large studies, both appeared in Lancet. One was in South Korea and the other one is US. Different findings, but US study actually said that there was a new onset mental health problems increased in patients who had COVID in the first 6 months of after they recovered from COVID. So that's a post-COVID problem. Trauma-related phenomena. I mean, I think PTSD, the classical description that we see in the nightmares, hypervigilance, what we see is we may not see all the symptoms of PTSD, but they can have nightmares of, and it may not be related to infection. It's just about staying away from the family, being alone, seeing a lot of things going around them. So I think PTSD phenomena is another thing that we are seeing. Then there's something very, of course, brain fog. That means not able to concentrate, feeling very mentally exhausted, not able to think clearly. This is something that people have been reporting post-COVID. So I think these are the some of the mental health problems. I've also, like I was discussing with Dr. Vishaka, that dissociation, we are seeing quite a few young women who are coming with dissociation. And this is in the context of, somebody died, death due to COVID and isolation, they themselves having COVID. So they are presenting with dissociative symptoms. So I think one important thing that I've noticed is the mental health presentations might vary from the culture to culture. So the way they present with depression or the response to stress can also be very different. So I just thought, what is it that we could do as health professionals? I think some brief questions. I just put 3 questions. Important one is substance abuse, because sometimes when they come in an acute phase or in a condition, if we could ask whether alcohol or anything, we could pick up withdrawal early and then treat it. Then any identifying at-risk individuals who have pre-existing mental health problems, who are taking psychotropics, because what is likely to happen is if they come with COVID infection, the psychotropic medications may be abruptly stopped and they can have an episode of mania or psychosis or anything. It can happen. And that becomes very difficult for the people who provide care for COVID patients, because when their patient is irritable, restless, they find it very difficult and they may not adhere to safety measures. They will not wear masks, or they might not sanitize themselves. They might be moving around. So these are some of the issues that can happen if they abruptly stop medications. So there are some screening questions that can be used to ask about anxiety or depression, PTSD. So like, for example, there are just 2 questions. How have you been feeling in the last 2 weeks? Are you feeling down, depressed, or upset? How are your energy levels? Have you lost interest in your pleasurable activities for depression? Anxiety can be about, sometimes it's also, you can even ask an open-ended question in terms of, how has been your mood in the last 2 weeks, and then take it further. So I think some of these questions, if we can, at any point when COVID patient is there, it's very, very important to address it. I also did not, the focus on women specifically is especially pregnant and postpartum. I think the challenges are, there's enough data now to say that women during the COVID phase, women have increased rates of psychological distress, anxiety, and depression. So I think it's important, and for them, some of the concerns are very valid. The pathways for their antenatal care is also challenging during lockdowns, and so this can all contribute to symptoms of depression and anxiety. So I think it's important for us to be aware of. So what, okay, let's say if somebody, we identify a mental health problem. So what do we do? How do we go about it? I think the first and foremost, the general principle, like I said, ensuring safety of the individual. So what type of an illness, either it is a very severe mental illness or is it anxiety or depression, and then you see how, whether the person has been on treatment or is off treatment. Is there, one of the thing is risk assessment. When I say is there a risk to self or risk to others? And then if possible, I know that care for COVID is being provided at various levels of health systems, including primary health to medical colleges. So I think it's important to just map some services. It may, like for example, I think some of the antidepressants are available. So if you're not, giving them multiple medications, maybe a good idea to just continue what the person is on, certain medications. But there are some concerns. I did not want to go into details of each of these medications because there are some concerns. Maybe we can take it up in discussion if the question. And maybe the other way of doing it is probably anxiety and depression. Milder forms can actually be handled with some basic interventions, psychological interventions that can be done by the doctors or the health professionals. Probably when you feel that moderate to severe, maybe involving a specialist is necessary. And follow-up course, now I think there's an emphasis that we need to have post-COVID care clinics. So there is a directive to have post-COVID care clinics. So I think it's important for us to provide follow-up care, because acute crisis we manage, but the consequences of having the grief, complicated grief or depression, or not able to go through the usual grieving process can have long-term mental health impact. So I think it's important for us to not just discuss mental health only till the pandemic is over, but also to, follow up and see how we can provide services. So we have actually brought out this document on guidelines for general medical and special mental health care settings. It's basically discusses various disorders and how to manage and how to use medication, and some basic counseling, like including breaking bad news or handling someone with how to handle grief in the acute situations. So there are various chapters on this. So it can be downloaded from NIMHANS website. It's www.nimhans.ac.in. So if you go there, you will have COVID-19 related resource material. So there's a lot of material even for child mental health and others, healthcare professionals. We also have a toll-free number. This is from the disaster unit, which actually runs this service. So anybody can call this number to avail psychological service or mental health support and services. Okay, so that's it from me.
Thank you, Geeta. That's an excellent introduction, just trying to provide a framework for how people can frame the questions, and I'll be waiting for the questions in the chat. While I see Mickey's not in her chair, Manju, could I, oh, there she is. Welcome back, Mickey, just in time. So if I can hand over the baton to you, Mickey, would you like me to share the Word document you had sent across? You are mute, Mickey.
Yeah, you can do that, Vishaka. I mean,
Okay.
It's very simple. In case anyone has any questions, they can answer them. I mean, I can answer them. Please forgive the typos. So do you want me to go ahead, Vishaka?
Go ahead, Mickey. I will try and scroll as you speak. Yeah, sorry.
No, I'm not even going to look at this, so don't worry about it.
Okay, fine. Brilliant. Okay, I shall, yes,
Okay.
please carry on.
So hi, everybody. I'm going to give you all just a little bit of a lesson in psychoanalytic thinking. And Vishaka has invited me to speak on this forum where you're all medical practitioners. And I'm certainly not a medical practitioner, but I just want to take you all through and help you all to understand what exactly is psychoanalysis, what is psychotherapy, and what is counseling. And if we can just understand that, so we can know what to administer in the time of need. So it's actually like this, and I'm going to give it to you in common sense and wait for all of you to ask me questions. Basically, mental health and help in mental health is a continuum. And it starts off with counseling, it goes a little deeper into psychotherapy, and it goes very deep into psychoanalysis. There are therapies of many different kinds. So you have psychoanalytic therapy, you can have cognitive behavior therapy, you can have rational emotive behavior therapy, you can have many different kinds. The reason I'm still sitting on this chair today is because I find that psychoanalysis to me and to day-to-day life makes the most amount of sense. So psychoanalysis, when it's done in its true form, is 4 to 5 times a week. And that's intense, and not too many countries can do it. It's private, it's expensive. So it's not always available unless there are charitable clinics like we have in Bombay that also impart this kind of psychoanalytic help. Psychotherapy is there. I know that we've done quite a lot of work with the NHS as well. And I think a lot of you are in the UK. So psychotherapy and psychoanalytic psychotherapy at the Tavistock Clinic is quite rampant in the UK. So that's as much as I want to say about psychoanalysis. Now, people can't always avail of psychoanalysis, right? But my latest mission in life is for people to just avail of some kind of psychoanalytic thinking. Now, what is psychoanalytic thinking? It's nothing but common sense. And I'm going to take you through a couple of things which I've written up here, which is what psychoanalysis is about. Of course, there's a process. Of course, there's a lot of theory. But we don't have time for that here. So that's as far as psychotherapy and psychoanalysis is concerned. Now, coming on to COVID and trying to understand why psychoanalytic help is actually a form that will help people pre-COVID, post-COVID, even if you've never had COVID, just living in these times. Now I'm going to try and explain it, and you can help me as we go along. So I think deep down in our unconscious, there is anxiety. Anxiety is the sentinel that rings on the watchtower every time something happens. So deep down, we have inside us, in our unconscious, a deep fear, which is actually called, by an analyst called Wilfred Bien, is called nameless dread. Now, this nameless dread is something that exists, and we have the fear of life and we have the fear of death. Now, there are certain defenses that we have developed over time and which we develop over generations to fight those fears. And those fears are fear of anxiety, fear of death, fear of separation, fear of pain. These are age-old anxieties that have existed since time immemorial. So what happens to protect us from all these defenses? Actually, I'm not looking at this. So what happens to protect us from these anxieties? The first thing that happens, And the biggest thing that happens is that we develop defenses. Otherwise, we wouldn't be able to function in day-to-day life. Now, from what little I understand and the psychoanalytic research that has been done so far, is that this COVID-19 virus attacks the human system and attaches itself onto the host body in such a way that all our anxieties, all our feelings come to the fore and our defenses break down. When our defenses break down, we are faced with anxiety, we are faced with depression, we are faced with insomnia, we are faced with acute fear. All these things are happening. And at some level, we're in a mess. So no, there's no solution to this, and it's multidimensional. And I don't know how many cures supposedly I can give. But we can talk about some ways to think about this a little further. So that's as far as what happens. Now, whether we are a medical practitioner, whether I'm a psychoanalyst sitting on my chair, whether there's somebody working at home, whether you're a doctor on the field, we are all actually feeling the same thing. And our different defenses are keeping us protected. But hey presto, we don't know when those defenses. So we don't know when these defenses are going to collapse. They collapse at different times, on different days, in different ways. I think Dr. Mishra had said something about pre-COVID, and if we've suffered a loss earlier, and if there are pre-COVID symptoms. Of course, all those are really important. Now, just to move on to some basic thoughts about psychoanalysis. Psychoanalysis is the only science that actually deals with the unconscious. Now, in our unconscious, we've got all kinds of things stored over there. Can we get in touch with our unconscious on a daily basis? If we're not undergoing psychoanalysis, the answer is no. But can we get in touch with our feelings, the way we think, the way we are feeling, if we're angry, if we're upset, if we're unhappy? The answer is yes. And this is a plea for all of us to just feel, and feel. And when we feel, we can actually acknowledge that we are feeling bad. Now, the thing that when we feel really bad, what do we want people to do? They want people to listen, which brings me to my point of how do we listen to people? How do we speak to people? Actually, there's a difference between speaking and there's a difference between listening. When you're speaking to somebody, you're not involved. When you're listening to somebody, you're really listening. And, you know, we're all struggling to survive today. And I try and do this at home as much as possible. If I'm talking to my family members, I tell them to get off their phone. So then they're only talking to me or they're only listening to me. It really helps. Now, what does listening do? It actually makes that person feel heard. So if that person is saying that I'm tired and somebody says, I can understand that you're tired, or let me make you a cup of tea, that person is feeling held or that person is feeling understood. What do we do? And I think we've done this for generations together, and I've done it and I still do it, and all of us do it. Somebody says you're tired. My very own husband will tell me, you're always tired, or you're always saying that you're finding it difficult. Why do you take so many patients? You don't have to take so many patients, and stuff like that. But actually, that's not what we need. And now I think I've taught my family successfully that what we need is just to be heard. And I think this is something that we can put in practice in our day-to-day life. Also, talking to all you medical practitioners, medical profession is looked upon as the most powerful profession, right? This is the first time, or one of the first few times, that you can't actually deliver because so little is known, and because this COVID-19 puts us in touch with death, and you can't save people from dying. So some part of y'all is even numb when you're out there. Now, so according to me, suddenly even the gods don't have the answer. And you yourself are scared for yourself and your loved ones. You might be having someone at home who's got COVID. You might be worried about your family and friends back in India who have got COVID. Then, of course, you've got all the news channels, which is giving you minute by minute on all the bodies floating in the Ganga and stuff like that. And then the Kumbh Mela and stuff like that happening. It's a traumatizing time, basically, for everybody. So I want to say a little bit about psychoanalysis is not a solution-oriented science. Now, if somebody comes and says that I'm depressed, I'm not going to be able to offer a solution. Even psychoanalytic thinking is not about offering a solution. It's about helping the person to understand what is the nature of their depression, what is the nature about their anxiety, how can they best handle that depression and that anxiety. Also to help them through a process of loss and to recover whatever they can with whomever they've lost. Because loss, we all know as adults, is not reversible. It's happening, it's happened, it's going to continue to happen all the time. And here we pick up our phones, we pick up our tablets, and we all have so many people that we've lost. Which brings me to the topic of mourning. And mourning is really important. People are allergic to the word mourning. They think that mourning is dismal, mourning means only rituals. But I think mourning is one of the healthiest processes, to be able to talk to people about who they lost. What dish did your mother make, which was your favorite? To remember people, I think is really therapeutic in the entire mourning process and helps firmly ensconce the person in one's mind. Now, just a little word about affliction and being affected. We are all afflicted with this COVID-19. How much are we going to allow ourselves to get affected is a question. At this current moment, we're all sitting here, we're all listening, we're all anxious. It's the need of the hour. It's happening all the time. What do we do with this anxiety? Do we shout at the pharmacist who's not wearing a mask? Do we shout at somebody on the road who's not wearing a mask? Sometimes we actually shout at a medical practitioner who's not able to save the life of a loved one. So how much can we keep this anxiety within us and not project it outwards? Because sometimes we just project it outwards. We feel like we've momentarily got rid of it and then it returns. The fact of the matter is that we have to understand that the situation is dismal. We know very little about the situation and we're doing the best that we can. And I think that's what your patients also need to know. I don't think we can do anything other than that. I just want to say a word about toxic positivity. I had COVID, my entire family had COVID. And I noticed that everybody who called me or spoke to me when I had COVID said, please be positive. I don't understand this positive because according to me, positive can get toxic. I didn't want to be positive at that time. I was looking for my will. I was wondering whether I was going to last. I was looking at all the readings. Everybody was anxious. How can you be positive? How do you actually be positive? I really don't know a way. Instead of that, the friends and the family who allowed me to be as negative as I wanted to, who just allowed me to talk, who just allowed me to process what I was feeling post-COVID, even now, is much more of a blessing. And that's what I really wanted to talk to you all about. So that's really few commonplace things that we can think about and we can take up more as the questions come along.
Brilliant. Thank you very much, Mickey, for that insight. I think it'll probably get people thinking a little bit about how they want to frame issues that they may be thinking about. Why don't I hand over to Manju? Manju, are you ready? Do you want
Yes,
to? Yeah,
yes.
brilliant. Okay,
So,
I'm going to mute myself. Thank you.
so I'm going to tell you a little bit about PTRC to start with. That PTRC has a couple of clinics, which our aim is to reach out to people across the board, affluent, non-affluent. We work on a sliding scale so that we can make it affordable to people from low-income families, okay? We have also set up a couple of, we've set up counseling units, it's called counseling units, in a couple of schools. Most of the children are not from affluent homes. They come from low income, middle income families, and a lot of the low income families live in one room, single room homes, you know. So they might have a little kitchen on the side and a bathroom, or they live in chawl systems. But so you have families of 5 and 6 and 7 all living together. And I'm just telling you this as a background. So PTRC has set up counseling units in these schools. And one of the very important thing that our main request is for a counseling room that is private, it's confidential. We work in slightly different way. We, like, you know, before starting, you know, we speak to the headmistress and, you know, the teachers that we're very happy to help you, but we're not available on tap. You know, like there might be an emergency in school and they want us to come down and meet the principal and talk to some parents. We can do it. We will fix appointments to meet the parents, but we won't come rushing down. Okay, we will do it at a time, because we might be if I'm in a session, I don't want to be interrupted. That child's time is important. Having said that, we work with parents and children. A lot of the referrals may come from the teachers, but these children are not captive audience. Parents have a right, so we always meet the parents first, talk to them, tell them about the way we work. We give them a form to fill. It gives them a little space to think about whether they want to send their child for counseling. They don't want to send their child for counseling. They have a right. They are the parents. They have a right in what they choose to do. So in school, you have that private space. And, you know, we have a notice on the door that says, busy, do not disturb. And why I'm telling you this is because in this pandemic, it has not been so easy to work with children from low-income families. There's lack of privacy is a very big factor. They may not all have access to their own phones. So it's been quite a struggle to try and work online with children, you know, during this pandemic, and no privacy. So in the counseling room, parents can speak freely. Whatever they say is confidential. What the children say is confidential. We tell the parents this in the beginning. We tell the school, the teachers. Everybody knows that what children talk to us is private and confidential, and what the parents. So privacy has been thrown out of the window, and, you know, during the pandemic, unless you have access to a space of your own. Now the difficulty is for children is that, as I see it, that at the moment there is no ending to this pandemic. It's gone, you know, it's gone on and on. It has caused a lot of uncertainty in adults, in children. You know, you want to know when something is coming to an end. You want to know that there's a beginning and an end to something. This is so open-ended. It has stirred so many fears. I want to say not just in children, but in adults as well, you know. So apart from that is for children, the fear of will they get COVID? Will their parents get COVID? What will happen? And why I'm saying this is because children, oh, sorry, I wanted to say one more thing is that I'm going back to school. That schools provide a very important structure for children. That structure that schools provide, they provide structure, that's gone. They provide socialization. Schools are not just about learning. It is about learning to interact with your peers, negotiating with them. All this has gone during the pandemic. It's so much harder to study online. Children who have difficulty anyway in schools, at least in schools, the teachers are there. They can see what's going on. They can pick it up. Online, it's much harder for children who have difficulties to study. How much they are learning, God knows. I imagine that long after the pandemic and when children are back in school, there will be children and teachers trying to play catch up. What's going to happen? How do these, so much that is missed. How will they catch up on all of that? That's a big question that I know a lot of teachers have. Children are very dependent on their parents to have all their needs met, to be understood, not just the physical needs, but emotional needs as well. So they're very dependent on their parents to understand them. They're dependent on them to meet their needs. Parents try their best. They do it the best that they can. Sometimes not every need may be understood or be able to met, but they certainly try and do their best. Now, the fear is, for children during this COVID time is fear of getting COVID themselves, their parents getting COVID, loss of a parent. That is a huge loss of who's going to contain them, who's going to look. So it throws up too many questions. Who's going to be there to look after them? Who's going to be able to contain them and hold them? I'm going to stop over there, and then we can wait for,
Yeah, I think that's great, Manju. Thank you. I think that's right. This is so much to discuss. I think that it's probably best if we start taking some questions now, and that may help see what the audience is particularly aiming towards. So I'll take it in a round robin. I've got a few questions that have come up in the chat and a few others that were there from before. So if I ask Geeta, first of all, yourself, in the chat, there was a question, should we be referring all patients who have been, for example, through ICU or those who have survived COVID, should they all receive some form of psychological or mental health support? Is that something that you feel would be beneficial, is almost a requirement or not?
They may not need a specialist service, but what I would say is probably screening. Screening is something that can be done. And maybe just doing it at one point of time may not be sufficient. Like, for example, the focus is so much on physical aspects during the ICU care that, often even patients may not really acknowledge that they're distressed or anything. So I think at various points of time, screening by a physician itself is good enough, according to me, because now I don't think we can have a specialist coming in and screening them. But I think it's important to, like I said, post ICU care and post COVID, it's important to just have an idea about, if there are any mental health issues. I think it's important.
So can I ask a follow-up question on that, or just from what
Yes.
you've said? How long do you think should we be continuing the screening? How long should we be aware of these issues? Do you have any personal opinion or thoughts on that? We know we're not even out of the pandemic yet, but so
I mean, this whole long COVID and post COVID, nobody really knows how long this long COVID is going to be. So I don't know the answer. I would really think maybe 6 months, 1 year, because again, this is not a very, I cannot really say that this is how it has to be done, because if there are some risk factors, let's say that there are multiple losses in a family, I would probably follow them up a little more closely. And if I know that there's some adequate support system, or if they don't have any other past psychiatric history, looking at their risk profile, probably depending on that, we can take a decision on how often we can screen, how long we can screen.
brilliant. And that leads on to another question that was in the chat. What you talk about screening. Are there some tools, validated tools, sort of key screening questionnaires that doctors can use? You mentioned a couple of questions in your talk, and I see something coming up on the screen as well. Do you recommend things like the anxiety and depression scores? What would you think would be quick?
We need to be very aware about the time that we have in assessments. So I would probably look at 2 questions for depression and 2 questions for anxiety. I'm not even looking at screening for all the mental health conditions. Like, for example, let's say you start with asking the person, have you ever received any sort of mental health treatment, or have you, and then second question can be, are you facing any difficulties with your mental health? Like, for example, but that same thing may not work in all populations. In a rural population, you might have to, rural and urban, there can be some differences, or educated. Everybody has a right for mental health. So we need to probably start with asking them about their past history, and then the current mental health in terms of mood, energy levels, and interests. I think this is something that can be done.
Okay. I wonder if people are also wondering about, like as I said, yes, this is a screening sort of in terms of just generally inquiring, perhaps even an open-ended question. Yes. But are there any that you would use specifically?
One is the patient health questionnaire. Mm-hmm. That's also, actually, it's used even the many medical conditions, patient health questionnaire, the first 2 questions, screening questionnaires. I think there was a question on pregnant and postpartum women, again for depression. That's Woolley's questions are there. Woolley's, WHOOLEY. There are 2 questions. One is on mood and one is on interest. So these are 2 screening questions that can be done by anyone, even Anganwadi worker or Asha. So that's something that can be done. Of course, like I said, even though I gave a spectrum of mental health conditions, what the screening is predominantly for depression and anxiety. Also, there's a scale called generalized anxiety, GAD-7. There again, 2 questions are there, 2 questions that can be used to screen for anxiety.
Okay. I think my next question, Mickey, is to you. In terms of sort of what would be your perspective on, say, when we're talking to the public and we're dealing with a lot of backlash and anger at healthcare professionals? It is difficult for medical health professionals to process that, to understand that. All you're seeing is you see millions of YouTube videos and WhatsApp videos of doctors and young healthcare workers and everyone being trashed by relatives. Where do you think that is stemming from? How can we as healthcare professionals perhaps seek to influence that behavior? Are there ways we can do it or not? Sorry, you're on mute, Mickey.
So just to understand what this backlash is all about, Vishaka, I think the backlash, like I mentioned earlier, is that doctors are supposed to be gods. they're supposed to be able to cure and put an end to all strife, supposedly. This time they're not able to. But I think this backlash when the general public is maligning them also is a defense which is used called splitting, because at one level, doctors are idealized. At another level, there's this backlash because it's nothing but the helplessness evoked by the helpless condition that we are in, that anything could happen. So actually, it's a projection of our own helpless feeling as well, because in this particular scenario, the two things are not going to come together, and the person may not get better, or the person will get better and it will take time, and there will be residue.
Okay.
Does that help?
Yes, I was just wondering, is there anything we can do, to kind of deflect it perhaps, or how do we process that? Because at the end of the day, it is distressing. You're trying to do your best for your patients, and you find that the feedback you're getting from them, far from being encouraging, is actually putting you off from trying to do your best. And that takes a toll for a tired health force, for a fatigued health force who themselves, been working for months under pressure. What do you think would be our resource to protect ourselves?
So Vishaka, that's a
protect
tough.
ourselves psychologically and not physically.
Yeah, so I think that's a tough one. I think we have to be able to understand that actually this is something that we're not going to be able to deflect. It's very much directed at us, and we don't get it as analysts as much as Dr. Desai would get it, but even we get a lot of it. And the idea is to put a little bit of separation between the patient and yourself, because this is coming out of their helplessness also. And so to understand that this is coming out of their helplessness and their frustration, and the fact that they are being invaded by all these symptoms, which they have no idea how to handle. And I think another way in which we can deal with it is to listen as empathetically as possible.
Okay. I think
I was thinking, sorry, can I just add?
Of course.
To me, it feels like an outpouring of grief on the people, the relatives' part. It's such an outpouring of grief that they are unable to cope with at that moment, that they have to lash out.
I think it is a difficult topic, and it's an uncomfortable one for us as well, I think, at some level.
I want to say something, Vishaka. Also talking about what can medical practitioners in the field do. It's not a bad idea for medical practitioners to get some help for themselves. So I know in Mumbai, and I've heard of lots of helplines where people actually have sessions for medical care, people who are in the field of medical care, because they also need to talk about what they are facing, because they can't go home and talk to their family about it, because the family will get worried. But to see people dying, I mean, they almost get numb. So if they have someone to talk to, and I know we have helplines which often ring off the hook, where people can come and talk once, twice, just talk about how they feel. I think that's helpful.
I think there are a few questions towards you, Manju, about school, about children and school. I'll probably put them all together. The first is, what has been the effect of, you already alluded a little bit to that, about online education, the lack of structure, lack of social sort of interaction and so on. What has the effect, if at all, if you probably haven't seen it yet, but what do you anticipate would be the effect of on the development of children in the future, whether that's emotional or academic, this effect of this no school sort of scenario? Do you have any thoughts? Are you beginning to see anything at all?
So what I was thinking about working online is that it is loss of the school structure, loss of interacting with their friends, taking part in activities, playing, just generally chit-chatting. children tend to bring a lot of the problems or difficulties that they have into the school environment, and it's quite often picked up by the teachers. They may not always be able to say exactly what they feel is wrong, but they are able to say something is not right. This child needs to be referred for therapy, okay? So they have, all this is not being picked up, you know. Also, I think that online, over the course of the year, I've noticed that very often some of the children have managed to come online and work throughout the year and make use of it. But for a lot of younger children, the method of the way we work, we use it's play and through their drawings and things like that. So it's not quite the same playing in your own room. In school, we provide them with things that are useful, that they can use to show us things. They can climb up on the table and jump or do all those things which they would not be, you know, you can't do it over the internet. So much of what they can express in school is not, they're not able to communicate through the internet. A lot of that gets lost. Yes, they can do drawings, they can show us their drawings and we can talk about that. But a lot about what we pick up just from the way they enter the room, what they do, how they use the material, how they treat the material, how, you know, all that doesn't come through over the internet. And I think the worry with a lot of, when they come to school, they bring in a lot of these things for us to pick up. And, you know, in the sessions, we can pick up things like I was reminded about a little girl whose parent had died, and the mother had not been able to mourn the loss of her husband. And initially, this mother was very able to see the difficulties that her child was having and to acknowledge her difficulties. And because he was not able to talk about himself, everything was spoken through cartoon characters. So it was like he was a cartoon character and she was a cartoon character and everything was spoken through her. So what's happened is that in the lockdown, her fears of losing her daughter have been exacerbated, so that it's very difficult for her to let her child go out and play and to mix and to socialize with 2 or 3 children in the building. Her daughter is more or less kept at home. So the change that we saw while she was in school, where she began to open up, she began to talk about herself, has been reversed. It has become very introverted.
I think that actually feeds into a couple of questions that I've been seeing on the chat about how to manage these children who are facing either isolation or exhibiting, you know, aggressive behavior, for example, or are withdrawing into their own shell. What ways are available? Perhaps how do parents tackle these sort of scenarios? You know, how do you tackle the child who's acting out, who's being aggressive, or is withdrawing into a shell and not communicating, for example?
I'm going to ask Mickey to follow up on what I say. I was thinking that it's very important for parents to try and talk to their children, to try and understand what's going on. And parents are like containers container figures for what their children, or receptacles for what their children are going through. Children may not always be able to put into words what they are feeling, which is what we do through play therapies, try to understand. And it's not just through play therapy, it is through transference feelings of what they evoke in us that we try and understand what's going on. Parents, teachers, everybody gets a bite of that, receives those feelings, and to try and understand what their child is going through. Mickey, anything else you want to add?
Yeah, I wanted to say that actually, when dealing with children, it's very important to acknowledge their fear, Vishaka. So not just ask them why you're scared, but it's okay to be scared. It's okay to be anxious. I'm also scared. Let's see what we can do to, handle this fear. And having said that, it's very frightening for a parent to have their child suddenly go into the room and lock themselves up for hours together. And you can tell them that if you do go and lock yourself up, I mean, it would be better if you talked about it. I can understand that you want your space, and it could be because school isn't there and so on and so forth. I think it's important after a little while that you come out and talk to us. And sometimes a little bit of negotiation also, that you can stay inside for 1 hour and then come and talk to me, or some kind of negotiation.
Yeah.
Because what's the biggest fear that comes into a parent's mind, depending on previous pathology, of course? What's the child doing? Is he going to cut himself? Is he doing something? Is there something that he can't talk about? In this kind of pandemic, our fear immediately goes there. It's not just if a child locks themselves in a room. If your child goes out and doesn't come back at the appointed hour, the first thought is that of something quite severe. That's where our mind normally goes.
Okay. Thank you, Mickey.
You got a good sense of position sense. Yeah. Geographical sense, position sense. Yeah. You know how to follow the instructions of the Google.
Hello, sorry guys, can I ask people to mute?
That's the only thing you need.
Bye.
Bye.
Seem to have, sorry about that. Geeta, can I ask a couple of questions that came up on the chat about whether there's any data, whether there are any studies that have come out of post-COVID sort of effect on mental health in terms of memory or brain function, and whether we have any data regarding that, and how your experience about how patients who have been through COVID are dealing with mental health issues. Are you seeing increasing numbers of them, for example, even if we have not got, not reached the point where we're collecting data yet about these things? Are you beginning to see that?
I mean, I think from probably now we are going to, now the lockdowns are a bit eased, so we are seeing more number of patients. So as of now, we don't have data related to post-COVID mental health problems, but we do have, we are seeing more number of, patients with mental health sequelae following either they have had COVID or one of their family member who's had COVID. I think cognitive issues, we would probably need to wait for some more time before we, get some data and see how it goes. From other countries, there are studies which have looked at some executive functions, but not from ENHANCE as of yet. We're still coming out of, the numbers are better, COVID numbers are better now. So I hope if things are fine, we should be able to collect some data.
Actually, I'd like to open this up to all three of you, in fact. We spoke about stigma earlier on, and I know in the chat people have commented on the issue of stigma and how it impacts people's responses to how they're behaving in the pandemic, either, in terms of not attending testing so they can avoid the stigma, or other behaviors, possibly non-adherence. So if I ask, and all three of you are, I'm happy, like to hear your views. What do you, what can we do? What are the patterns you're observing? What are the sort of things that we can be doing to help that situation, to alleviate that stigma, essentially? Geeta, do you want to go first? No.
I think stigma probably in the second wave was not as much as it was in the first wave, because the way the first wave was handled was there were posters that were pasted on the person's house who was positive, or their area, the house. So it was very obvious then, and those patients, and even I think at every level they had to face, not just in the family, and they would not nobody would interact with them. And even when they go to the hospital, so there would be a COVID group, non-COVID group. So it's multiple layers are of stigma were there. And I think when I talk about stigma, it's also a lot of perceived stigma. Often I think people also felt that they were being discriminated based on whether you're COVID positive or COVID negative. uh, the second wave was so hard. I don't think these steps were taken up. Of course they were, they would put up some banners outside some of the apartment complexes saying containment zone, but it was much. Uh, I think it's a little better in the second wave. Like all other illnesses, like for example HIV, when it was at its peak, there was a lot of stigma, and over a period of time, lot of illegal. It's a very systemic problem. It's not just merely. It's not going to go away just by saying, by education. Education is just one part of it. I think it's a larger issue.
Mickey or Manju, do you have any views on that? Mickey? You're on mute, Mickey.
I agree with Geeta. I think the stigma was much more in the first wave than in the second wave. But something that I have learned in this COVID time is that everybody reacts differently. And we very easily use the word paranoid. And we forget that people have other histories. There are people who could have had cancer or leukemia or whatever it might be, and feel the need to be much more careful. There are also different personalities dealing with the COVID situation. So I think it's important to just accept whatever it is people want to do, but it's hard not to, one forms a kind of judgment and one gets a little impatient. But as a stigma, I think the BMC, which is the Bombay Municipal Corporation, with their big notices and families almost treating you like you've got a communicable disease, which in some ways it is. It didn't help the situation. It didn't help the anxiety. But I think that got better with the second wave. And I also want to say that the stigma for therapy is an interesting one that I noticed. I think people, and I don't know if Geeta meant the same thing by screening, but people are more available to talk. People are much more willing to come for help. People are much more willing to talk about their anxiety to do with the therapy, kids included. That's what we noticed. So I think the stigma for therapy has been steadily declining, and COVID has made it decline even further.
I think that's good to know, really, because I think that is one of the things that has probably prevented a lot of people from getting the help they've needed in the past for other things. Are there lessons we can learn from how we've tried to alleviate stigma for other conditions? Is there things that we can apply to the COVID pandemic that we can begin to, knowing that it was, how it is, we know it impacts people, we know it impacts how people access help and so on. So are there things that if you were given free rein, what sort of approaches would you encourage? What sort of approaches would you apply to try and, prevent this from becoming a larger problem? What would you say to health authorities? What would you say to councils? Or what would you say to municipal corporations? Where do you think? Any of you?
I had a thought relating to the previous question, and I'm just going back to it, that about stigma, but I think that a lot of people personally are still afraid to get tested when they think they might have COVID. They're still afraid of getting that positive result. So whether stigma is only out there or it's tied in with fear.
Okay, I think there's a couple of other questions related to this topic that have come up. One is, are you aware, I know you all were practiced in India, but are you aware from discussions with colleagues that this is an issue in other places, in other countries of the world as well? Geeta, do you know?
Yeah, I think it's not peculiar. I mean, I don't think it's just in India. I think if you look at the history of how pandemics and, the initial few, until we understand about the illness, the first few years are going to be mired with probably there's a lot of fear, anxiety, stigma. Like I think somebody has also put up a question saying that isn't the label on flats more for contaminated garbage collection? So that's why I said it's not stigma as a whole, it's a perceived stigma. Like how I perceive is also very important. It's not that the other person does something actively to make me feel stigmatized, but the way I perceive is also very important. So I think it's something that evolves. So few things that are like, for example, how do we say that, people who seek help for mental health are nowadays less stigmatized? That's because I think the mental health awareness has probably increased. One is awareness, and the second thing is also about the consequences of another person knowing about your illness. That's something that we all need to be, like, for example, stigma, then discrimination. Like, for if somebody has a mental illness and they are seeking treatment, how does that information affect the person's environment, a workplace? How is it going to get affected? If somebody has diabetes, probably, they're okay in discussing, but would they say the same thing about mental health? No, because the person who understands mental health may not be, discriminating, but awareness, I think, is the most important thing. But with COVID, I think we are learning everything new. It's every day some new information is coming up. So we need to keep, educating. We also need to practice a lot of some of these things, because even in health professionals also have faced stigma. It's not just the patients. Many health professionals had difficulties during, especially the first phase.
Going to slight change of tack over here because there are a couple of sort of from previously things that we've hoped we could cover. Medications, you spoke again briefly about that, Geeta, as well. Are there things that non-specialists like myself and other people who are working on the ground, are there, a group of medications that we could use safely? What sort of scenarios do you think are safe? And again, you alluded very briefly to medications that may have concerns with use during COVID because of interactions or effects. If you could just very briefly go through, just for our awareness, what are those sort of things that may be those medication things?
Yeah, I think some of the antipsychotics, like for example, olanzapine, clozapine, can increase the QTC interval, potentially known to have effect on the heart. So if a person develops COVID and has myocarditis, so that could be a potential problem. So, if you're going to start something, so ensure that, you have the cardiac evaluation done before you start off anything new. SSRIs in general, especially escitalopram, has lesser interactions. So that is something that can be considered, so moderate to severe depression, that can be considered. I mean, as much as I know, with remdesivir, not many drug interactions are there. But that's antipsychotics. Benzodiazepine, I mean, often I think that's the commonly used benzodiazepines for insomnia and sleep-related problems. There, I think we have to be a little cautious because some of these benzodiazepines can cause respiratory depression and, in a susceptible individual. So one has to be a bit cautious in using them. Like I said, there's no one medication which I can say which is very, very safe. It has to be individualized depending on the severity of the condition, other comorbidities. Like, for example, if somebody already has diabetes and is on steroids and you give them olanzapine, that can actually make it difficult. So it's better to individualize it rather than kind of, there's no safe medications like that.
Fair enough. Fair enough. Thank you. Mickey, Manju, can I ask some questions about you? You mentioned about resources in Mumbai. Are you aware of what sort of, so for people living elsewhere in the country, for example, Karnataka, etc., if you're looking for well-being resources for, say, let's start with volunteers and healthcare workers, what sort of resources do you think are accessible without actually, say, a therapy session? Are you aware of any sort of online resources or other resources that can be shared, say with teams, for example, like when we were discussing, we're talking, a lot of us have a work in teams and we see our team members being impacted as a result of the work they're doing, of the fatigue and so on. So do you know of easily accessible resources that we can signpost them to, for example, to get it started without, formally sending them for therapies and so on? Sorry, you're on mute again, Nikki.
Some of the ones that I can think of is the one Anasuya has set up with all the volunteers in different parts of urban and rural India, where she actually works with people on the ground. And I'm not exactly sure of the names, but we have a helpline. I know TIS has a helpline. I know for a fact that Empower, which is a Birla initiative, also has a helpline. There are lots of them. I could send them to you, but these are the ones that I can remember off the cuff.
Actually, that's really helpful. I think the people in the group would really value that if you had access to that, you could look for options. And are these sort of resources available multilingual? Are they in different languages and things? Are you aware of
a lot of times they're multilingual. The service that we provide is multilingual. So they're directed to the therapist who can speak that particular language, for sure. But they're limited to 15 and 20 minutes. And they're usually not charged either. So mind you, sometimes this becomes a way of seeking regular therapy also. So there's a way of doing them as well. We usually see them for about 2 or 3 times without any cost, understand what they want. And sometimes it's their way of coming in for therapy also.
Well, that's really useful. I think that's really handy for people.
Somebody's, I think Ravindra's written over here that he was not talking about the stigma of the disease, but talking about the stigma for counseling. And I just wanted to say something that we haven't covered at this point, that with the large number of people suddenly coming for counseling and therapy, I think the fact that everybody can be told that each one has their own story and it's safe with the therapist and there's a tremendous confidentiality clause and you're not going to be spoken about is quite sacred in making people feel safe.
Well, I think we're drawing to the close actually. So, and there are probably many other things that people are mulling over. And at some point, if anybody writes to me, I'll be very happy to pass questions on and be a conduit. But I really want to thank all 3 of you really for taking the time, not just this hour and a half, but all the other hours that I have taken of yours to come here. I also want to thank, I don't know if Dhananjay is still there, but Dhananjay for putting us in touch with Geeta. Who's come here, and Miki, you mentioned Alo. She's not on the call, obviously, but Anasuya Sengupta, who put us in touch with you and Manju. It's very difficult for us otherwise to find, not having the same length of communication, but this is a great example of networking. Any final thoughts, if I just go around all 3 of you, some particular take-home message that you think, you should leave with us for the sort of, just a 5-10 second, sort of key message of the day, that'd be really helpful. Geeta, from you.
I think mental health is as important as physical health. And not just for patients, but our mental health is also very important. So self-care is something that we all should practice. And I just wanted to say that they have requested for questionnaires. I would be sharing it with you so you can pass it on to them.
Brilliant. Thank you so much.
Wonderful experience.
Thank you very much, Geeta. That's very helpful. Mickey, from you, any final words?
Just to continue to feel, be as open as possible, and try and be the best version of yourself.
Okay. Thank you, Mickey. And Manju? You're on mute. Sorry, Manju.
Sorry, nothing that I can think about at the moment.
Brilliant. Okay. Well, thank you all very much. And thank you to the audience for joining in and asking the questions. We will see you again on another session. Good night, good evening, good afternoon, wherever you are. Brilliant. Bye.
Bye.
Bye.